Now, the utter devastation in Japan will, of course, have a lasting effect on the people there and those here watching these images as well. We're joined now by Dr. Katy Kamkar, a psychologist at CAMH. She's joining us now. And, Doctor, I want to first just ask, for those who are in Japan who may have witnessed perhaps the worst of this, in other words, firsthand, either witnessing that tsunami or narrowly escaping with their lives, those people no doubt will be dealing with severe trauma.
Absolutely. We know that natural disasters such as earthquakes or tsunamis can really represent a significant risk factor for the mental health of trauma survivors. And of course, the psychological distress associated with those natural disasters typically is exacerbated by the significant stressors in the aftermath of those events, so such as all the community devastations and destructions and all the losses and the severity of the injuries.
Is it lessened by the fact that, no doubt many Japanese know that they live in the Ring of Fire? They know that this is a reality. They have many less severe earthquakes that they feel and they've experienced before. Does that lessen the impact of something like this?
Well, this is an interesting question. The knowing at times helps, but nevertheless, this trauma is very severe. And we know that the more unexpected and uncontrollable a traumatic event is, the more it could trigger symptoms such as post-traumatic stress disorder or very intense psychological distress.
Mm-hmm. And of course, we were just talking to one aid worker with World Vision. She outlined their primary goal is, of course, the children. How does it impact young children?
It impacts everyone, adults as well as young children, people, of course, who have been directly experienced this traumatic event, but also people who have just witnessed that, so maybe, in other cities. But children especially might report a lot of distressing images, a lot of distressing thoughts. The sleep might be disturbed. So very much like adults, children can be very much affected, if not even more affected. But in general, in regards to those natural disasters, people typically go through various phases. So the first phase is the impact phase. So people who have survived the traumatic incident try to protect their lives and the lives of others. After that is the post-disaster phase. So people might want to distance themselves or withdraw from the impact of the traumatic event. They might also experience various emotions: anger, shock, denial, panic symptoms. And after that, of course, is the recovery phase. So people might want to move to adjusting to the life post-event. But of course, the adjustment very much depends on the severity of the event and all the losses and the severity of the injuries.
And just what about us? We may be so far away, but when you see these images, when you see the emotion on people's faces, when you start to realize the real death toll, the impact on people, families, it affects you. It affects a lot of people. So as we take in all of that, how do we deal with that? Is it best to take that and translate into action, like, donate, make a donation, try to help?
Yes, very much so. Helping, donating can provide a great sense of satisfaction. Seeking social support is extremely important. Self-help groups, any cultural practices, spiritual practices, anything that can really help people. But eventually, what is important is for people to gather and to make collective decisions. It's important to also note that very often these traumatic events can result in some positive experiences, which could be personal growth, strengthened relationships, and also learning.
Okay. Well, it's a lot to take in for sure, and a lot to think about as many of us will be dealing with
Very
this.
much so.
Dr. Katy Kamkar is a psychologist at CAMH. Thank you.